Saturday in America's fraud investigations bring us to the golden state of California. Look at this number, $146 billion. Health and Human Service officials confirmed that number to Chris Rufo as the staggering amount of fraud in a single program in Gavin Newsom's state Medicaid system. Stop and think about that. $146 billion, a single program, a single state. That is slightly more than Warren Buffett's estimated net worth. It is more than the GDP of several small countries like the Marshall Islands and Dominica, just to name a few. And it is well over $100 billion more than the most valuable NFL team, the Dallas Cowboys. That is just for Medicaid, just in California. So imagine what the total number of fraud is when you count all the social programs in all 50 states. The Trump administration is imagining that, and they are now taking action in a stunning raid of hospice facilities in Gavin Newsom's California. Now, just this week, the Justice Department announced 8 people were arrested accused of defrauding the state out of more than $50 million. That includes one couple who runs a hospice care center in Anaheim. And in dramatic fashion, authorities swarmed their residents, sawing through the metal front gates of the property, and used a loudspeaker to get them to come outside. The couple is accused of defrauding taxpayers to the tune of $7 million. And according to reports, their center has been a problem for years. Over the past 5 years, they reported more than 97% of their patients lived, and that's in hospice. That is unheard of. 90% of patients, on average, die less than 6 months after admission. Now, last week, we brought you an exclusive interview with the vice chair of the Anti-Fraud Task Force, where he said accountability is coming.
These systems are set up for a high-trust society. We turn over money to the government pays it to people in need, and we all expect that people are going to participate in these programs honestly, and the reality is that they're not. The Department of Justice is gearing up to do mass prosecution efforts against fraudsters, people who benefited from the fraud, and people who covered up the fraud.
Joining me now, the other man behind it, Centers for Medicare and Medicaid Services, Dr. Mehmet Oz. Dr. Oz, our viewers are grateful that you are taking action. And I just want to confirm that amount from you, $146 billion. That's one program in California. How big do you think this fraud is nationwide?
Well, the $146 billion is the total amount of the Medicaid program. So obviously not the whole program is fraudulent, but there's significant amounts of it. We believe nationwide it's about $100 billion in Medicare and Medicaid. Okay, let me give you an idea of what that really means to the American people, because these numbers become science fiction after a while. If you're worried about Medicare being there for you, the golden safety net that we have, the crown jewel of our program, and you're worried it's going to expire because the trust fund's in trouble, this fraud, getting rid of it, will double the life expectancy of the Medicare trust fund. That's a massive increase in numbers of years of extra Americans who can trust that the program will be there for them. The amount of wasted money drives up the cost of all health care. And of course, when we're facing an affordability crisis across the board, this is a perfect place for all of us to focus. And Democrats have a hard time defending that they've been looking the other way for the last 4 years. And let me just make one sort of large overarching statement really important to be clear. We are an all-of-government approach. What the president did by appointing Vice President Vance to lead this task force is allow all agencies to work closely. So that means we can go to Treasury if we need banking reform to deal with money laundering. I can call on the DOJ or FBI or Office of Inspector General. Billy Asili, the U.S. Attorney in Los Angeles, led these raids that I was blessed to be at on Thursday morning. Pre-dawn hours, sneaking up on these guys in a swank neighborhood, beautiful house, which they paid for with ill-gotten gains from their hospice program, which they were running in Los Angeles. And a third of all hospice in the country, Callie, a third of them are in Los Angeles. That's impossible. So the question we should be asking ourselves is, why wasn't this already addressed? The people you see walked out there, they were they were indicted initially, at least they were questioned, in 2022. And so you start wondering what happened for the last 4 years. Why was no one watching the till?
That's unbelievable. They were questioned in 2022. I mean, was that by federal authorities? What was the Biden administration doing?
We don't know. Even within the agency of CMS that I'm blessed to run for the president, I ask a lot of folks who are here, and they say, well, we were sort of told not to make noise. All we were told to do was enroll more people in these programs. And listen, I love Medicaid. The president has said over and over he wants to love and cherish Medicare. These are beautiful programs. They have to work well for Americans who have fallen or are having trouble getting back up on their feet again. But we cannot have them defrauded, oftentimes by foreign nationals and individuals who just don't share our values. And the inability of us to deal with the real and rapid increase in fraud in these programs is devastating to these social safety net systems. I'll give you Minnesota as an example. When every child in the neighborhood has autism, because their mothers are being paid to say that, then no child really is getting autism services. In New York State, the #1 job in the state is not retail, it's personal care services, because we're paying to have people get their kids to walk the groceries up the stairs for them. So again, there's sometimes, and these programs are valuable, but when we start paying for services that your family used to do for you, taking care of basic kitchen efforts, transporting you to the doctor's office, providing you some basic support for understanding how to do your checking. These are literally things that some states are paying for, and it's devastating the programs in many different ways.
Dr. Oz, has Governor Gavin Newsom contacted you?
He is not. I've received his tweets, as has everybody else, but there doesn't seem to be a serious acknowledgement. And I'll give you one final data point on this. We were looking at a code that California was going to pass that would have gone into effect January 1st that would have made it very difficult for one doctor to own 10 or 15 or 25 hospices, or at least sign documents for these hospices. And for some reason, on December 19th, 11 days before it was supposed to go into effect, this code was canceled. We don't know why. I'm calling out Gavin Newsom right now. What went down? Why wouldn't you want to pass a simple health code, a safety code that would allow law enforcement in the state to start to patrol hospice in your program? And you know what? When California doesn't police the licensing of hospices, the federal government has to pay. Let me translate that. California does sloppy work, or frankly looks the other way when they know there's fraud happening, and New Mexico and Mississippi are paying the tab. That's not right.
Final question for you. These raids took place in California. Will we be seeing them nationwide in other states?
For sure. I happen to be in South Florida right now. There are twice as many durable medical equipment suppliers here in South Florida than there are McDonald's. And
wow.
That's not because Bobby Kennedy is shutting down McDonald's. We have rampant fraud here, and we believe the Cuban government might be involved in this effort. I was in Flushing, Queens, New York, where Chinese are involved in a program that is defrauding that state with these adult social daycare centers, which are basically congregation centers for fraud. Again, the state's looking the other way. They don't appreciate these problems. And here's the big question for a lot of viewers right now. Is this a flaw, or is this a feature of their programs? We're going to go after every state, red or blue, whatever it may be. We've written letters already. We will have these crackdowns. And when you see these brave SWAT officers swooping down to take out these criminals, it sends a very clear message. Don't walk from this problem if you're a criminal. You run away. I'll say that again. Don't walk, run.
Dr. Oz, our government often doesn't give us solutions, but you have, Andrew Ferguson has, the task force has. Thank you.
Be sure to like and subscribe for all the Fox News latest on YouTube, and catch full shows streaming now on Fox One.